I think that's a good analogy. Often it's people say, heart attack, heart disease, cancer, very different than addiction, but in fact they're almost the same. There's a huge genetic risk for all of those things. In fact, the genetic risk of addiction, substance use disorder is something like 50%. If your mom and dad have it, you're super at risk of developing a substance use disorder. We know then it sort of insidiously develops over time, hijacks the reward pathways, hijacks so many different parts of the brain and the body to a point that making a good decision is almost impossible. It gets really hard to make a better choice. The difference is though in that the end, sort of how it presents to doctors or to family members, still looks like choice, and I think that's hard for folks. With a heart attack looks like dead tissue in the brain. The substance use looks like the person who's still drinking, buying alcohol or using opiates or smoking weed. It's a behavior that's continuing. And that can be hard to equate with sort of laboratory values of a heart attack, I think, at times. And we see this with mental health sometimes. I know it's gotten better. I mean, historically, we would say the person's depressed just needs to do better. Now we understand there's all these things happening in the brain, but we can't quite equate the substance use behavior with what's going on in the brain in our minds just yet, and for what it's worth.